I have had several pediatric patients who very clearly had culture negative infections. And I knew they had infections not only because of symptoms.
When it comes to someone that comes to see you with their first or second UTI, does your testing and treatment approach differ as opposed to someone who has had this problem of recurrence for a long period of time?
Mhm. It does. I will say, however, that there's significant referral bias, as it's called. I
Yeah.
see very, very few patients who've only had one UTI before
Hmm.
seeing me. I've had a handful that have had two UTIs, and I've had quite a few who've perhaps had three.
Hmm.
Uh, but yes, I will generally speaking manage those patients with lower intensity regimens with the hopes that that will be sufficient for them.
Okay. And is there anything people can do when they are at that early stage of the recurrent UTI journey that can help? That is not the obvious kind of advice that everybody gets, which is wipe from front to back, pee after sex, drink more water. Obviously, people in that situation have tried those things. Is there something else that you would suggest that might help them to kind of break that cycle before it gets too bad?
Um, that's a difficult one. I will say that seeking prompt treatment is important.
Hmm.
Um, some patients try to just let their immune system fight off the infections, and it often can.
Hmm.
But in a number of patients, allowing the infection to really take hold, I think, triggers some severe bladder inflammation and injury that can take a long time to recover from. And also, um, there's very good evidence that prior bladder injury from infection sets the stage for increased risk of subsequent infections.
Hmm. Okay. And for people that have taken frequent or long-term antibiotics, does this have a long-term effect on their overall health?
At least in terms of the gut microbiome, which is one of the most studied areas with regards to longer term antibiotic use. Um, the bad news is, yes, the microbiome is altered while you're on antibiotics. And that should not be surprising. I mean, that is what antibiotics do, they kill bacteria.
Hmm.
The good news is that in the limited data that is out there, the gut microbiome does normalize after stopping antibiotics, but it can take up to 6 months.
Okay, that was going to be one of my questions as well. Given the link between the gut microbiome and the immune system, after you've taken antibiotics, are you then more vulnerable to other kinds of disease?
For sure. Of course, C. difficile infections, Clostridium difficile infections of the gut after antibiotic therapy is one of the most feared complications
Hmm.
of being on antibiotics. Um, and being on antibiotics also paradoxically seems to sometimes increase risk of subsequent UTIs. Now, that may also be because of altering the gut microbiome and allowing your pathogenic bacteria to overgrow
Hmm.
as a potential future source of UTIs.
Okay, and do you think there's anything that we can do to help that kind of reestablishment of good bacteria in the
Mm-hmm,
bladder, but also in the vagina and the gut after
mm-hmm,
antibiotic use?
mm-hmm. Yeah, for sure. In the gut, there are probiotics that have very good evidence for helping restore um, gut homeostasis after oral antibiotics. Um, a few of the products include Culturelle and Align. And this is based on quite a few clinical trials.
Hmm.
The evidence is strongest for those probiotics, as well as a yeast probiotic. Interesting, it's known as brewer's yeast,
Hmm.
Saccharomyces Boulardii. The evidence is very strong in terms of these probiotics for preventing antibiotic associated diarrhea.
Okay, that's good to know. And there's a few other questions that aren't quite related, but also to kind of prevention or possible cause of UTI. One is around oxalates and whether a high oxalate diet or an issue with oxalates might be the cause of recurrent UTI in some people.
Yeah, I would say there's no direct evidence for that. Indirectly, high oxalates in your urine from diet could contribute to UTIs in the sense that some patients are prone to forming infection stones,
Hmm.
which are stones that contain not only calcium oxalate, which is one of the most common um, substances in stones, but also bacteria. And in these patients, their stones will intermittently shed bacteria into the urine, which conceivably could contribute to UTIs.
Okay. And what about whether you can make your urine more acidic or more alkaline? Is either of those likely to help or cause an issue?
There is evidence that patients with more alkaline urine are more susceptible to infections by certain bacteria of their urinary tract. Um, Urinary acidification in most patients is not an issue, but some patients do have to be careful. Bladder injury caused by prior UTIs, I've noted, can increase susceptibility to acidic pH in the urine.
Hmm. Okay, that's interesting. We had a few questions about how much fluid you should drink. One of them, I mean, there's this notion that drinking more fluid will help with UTI symptoms. I know it's not a good idea to drink too much fluid, but if it is helping relieve the symptoms, someone wanted to know if they should be drinking fluid at night as well as during the day.
Um, so there was a very good clinical trial in JAMA Internal Medicine a number of years ago. It examined women of reproductive age who are prone to UTIs. And if normally these women drank 1.5 liters of water a day or less, um, and then they took half of these women and had them drink 3 liters of water a day, the group that drank 3 liters of water a day instead of their normal amount had about half as many UTIs. So, very significant therapeutic effect. Um, Now, 3 liters of water a day is a lot for most people,
Hmm.
depending, of course, on how big of a person you are. And that will, by definition, probably cause you to urinate more often. Um, the best way to try and handle that amount of fluid, in my opinion, is to sip it throughout the day rather than chug it in large quantities at a time. Because
Hmm.
we know that chugging large amounts of fluid at a time will very rapidly fill your bladder. And a major cause of urinary frequency and urgency is when your bladder fills quickly. So sipping water is probably less likely to exacerbate those types of symptoms.
Okay, one of the things that comes up with excessive intake of fluid is the possible depletion of minerals. Is that actually a problem? And at what point could that be a problem?
It has been reported that in patients who drink a vast amount of water, and by vast, I mean at least 5, 6 liters of water a day,
Hmm.
they can drop their blood sodium levels to dangerous levels. But again, it requires an extraordinary consumption of water.
We hear from many people who have children that experience recurrent UTI, and often we hear reports from them that the only advice they're offered by their clinician is to make sure that constipation is avoided in the child. Can you kind of fill us in on why constipation is raised so often in pediatric urology and not in adult urology?
Um, well, first of all, I do think constipation can be a contributor to UTIs for adults as well.
Hmm.
um, but there is extensive data showing that constipation in children in particular contributes to urinary symptoms and UTI risk. And it may be a little strange sounding why that may be, but there's at least two theories, which may both be correct, that could explain why there's this constipation UTI link. So, first of all, it may be a mechanical issue, and this mechanical issue can also apply for non-infectious urinary symptoms. So the mechanical consideration is that if the pelvis of a child is filled up with stool because of constipation, the bladder does not have enough room to work properly.
Mhm.
Okay. And that dysfunction can not only lead to urinary symptoms, but also increase susceptibility to UTI. The other hypothesis as to why constipation may contribute to UTI risk in children is related to the microbiome. So there is evidence that the microbiome is altered in the setting of constipation,
Mhm.
and presumably that is a what's called a dysbiotic adaptation, meaning that um, bacteria may be overgrowing in the gut that contribute to UTI risk.
Okay. If the constipation is not an issue, is it possible that a child can also have an embedded UTI?
Yeah. So, for example, some other common issues in children that increase their risk for recurrent or persistent UTI is infrequent voiding,
Mhm.
especially shortly after toilet training. The most common clinical scenario is a young child who loves playing and doesn't want to be bothered with stopping when their bladder is full to go to the bathroom.
Mhm.
And not surprisingly, if your bladder is chronically full, uh, you have stasis of the urine. And if there's a small amount of bacteria in there, it has plenty of time to grow and develop into an infection.
And when it comes to that for children, is your testing and treatment approach the same as it would be in adults, or is there something different that you would do?
Interestingly, for reasons that are unclear to me, children rarely have culture negative UTIs.
Mhm.
And so I tend to not perform microbiome testing on children. That being said, I have had several pediatric patients who very clearly had culture negative infections. And I knew they had infections not only because of symptoms, but in a few of those cases, they had x ray findings that clearly indicated they had kidney infection.
Mhm. What does the kidney infection look like on an X-ray?
So, on an ultrasound, you can see enlargement of the kidney and edema. So, edema is fluid within the tissues. On a CAT scan, you can see those types of findings as well. And if intravenous contrast is given on the CAT scan, you'll see some typical striations within the kidney indicative of kidney infection.
Okay. Do you have any advice for parents or guardians who care for children that do have recurrent UTI?
Yeah, so first of all, make sure the child does not get constipated. So, plenty of water, fruits and vegetables, and whole grains rather than refined grains. So, in other words, minimize white rice and white bread.
Mhm.
Um, and since infrequent voiding is a very common issue in young children, instituting something known as timed voiding can be very helpful, where you literally set a watch, and when the alarm goes off every 2 hours, you send the child to the bathroom, even if they don't want to.
Okay. And do you find those techniques help with a lot of pediatric patients?
It does. It doesn't help all patients, of course, but it helps
Mhm.
many of them.
Sometimes you need to be also treating alongside these behavioral changes so that they can kind of overcome what's happening.
So many of these patients will require to be on antibiotics temporarily while they're working on their voiding habits
Mhm.
to reduce their risk of a UTI during that period.
And children that do have frequent UTI, is it likely that they will continue to have that problem into adulthood, or do a lot of kids kind of grow out of this?
Um, Many children who are prone to UTIs, especially girls, um, sort of retain their susceptibility to infections as they get older, unfortunately,
Mhm.
especially during pregnancy. But some patients seem to outgrow it. And why would they outgrow it? There are some theories that the estrogenization of the vagina associated with puberty
Hmm.
allows for growth of lactic acid bacteria that prevent overgrowth of potential UTI causing bacteria.
Have you seen any research into that for premenopausal women, the estrogen link, I mean?
For premenopausal
Mhm.
women, not so much. Most of the research is focused on postmenopausal women.
Okay. You briefly mentioned imaging. Is that something that you recommend for all your patients, or is it just certain symptoms that would cause you to do a cystoscopy or a CT scan or something that you just mentioned earlier?
So, studies by others have suggested that most patients with uncomplicated UTIs, and again, I'm going to emphasize the
Hmm.
word uncomplicated, do not routinely need this type of evaluation. Um, I do not see many patients with uncomplicated UTIs.
Hmm.
Almost all of my practice are patients who have recurrent or persistent UTIs. And in that patient population, I do think an ultrasound of the urinary tract is not unreasonable, and even cystoscopy to look in the bladder. Um,
Hmm.
Many patients uh, will have inflammatory lesions in their bladder that, if you biopsied, which should not be done routinely, uh, will show the presence of bacteria as well as immune cells.
Hmm.
And evidence by Felipe Zimmern has indicated that for some of these patients, if you cauterize these lesions in their bladder, even if they've had antibiotic resistant UTIs, they can improve.
Hmm.
And that's actually been my experience as well. A subset of my patients with these inflammatory lesions that I've cauterized have had significant improvement.
Is that only done in the case where there are a few lesions? I imagine if there are a lot of areas in the bladder, you can't cauterize everything.
Mhm. It depends. It's a judgment call, obviously. If there's a very large swath of the bladder, then the risk benefit ratio is probably not favorable, because if
Hmm.
you cauterize too much of the surface area of the bladder, the patient's going to be very symptomatic just from that for a long time.
Hmm. Okay. So, kind of at the other end of the spectrum, there's also an issue of UTI in the elderly. And we get a lot of messages from people who have parents who are experiencing recurrent UTI. Is there a different approach that you would use in this case to help reduce the symptoms or even eliminate them entirely?
Well, for women, I definitely advocate for a trial of vaginal estrogen, because there's just so much medical evidence that that can reduce UTI risk. In men, it's trickier. Many of these men, that being said, have benign prostatic enlargement, and consideration should be made for medical or surgical reduction in size of the prostates.
Hmm.
Um, UTIs in the elderly are challenging and can be life threatening.
Hmm.
Many of these patients do not present with typical UTI symptoms and can very rapidly progress to life threatening infections.
What are some of the symptoms to look for in older people? Because we do hear stories about behavioral change that was later linked to a UTI. And in that case, that could definitely have become life threatening. Are there
Mm-hmm.
things to look for in older
Mm-hmm.
people?
Mm-hmm. Mm-hmm. Yeah, so many elderly people have atypical symptoms, changes in behavior, fevers, of course, or even low temperatures,
Hmm.
low blood pressure, should all be evaluated.
Okay. And urinary incontinence is also raised quite often as an issue in older people. Is there a link between incontinence and UTI? And what steps should people take to kind of help with the incontinence symptoms?
Yes, I think there's potentially some chicken or the egg issue here. Are elderly people prone to UTIs also incontinent because the UTIs are causing them to be incontinent?
Mhm.
Or is the incontinence or the underlying cause of the incontinence somehow contributing to their UTI risk? I think it could be both. The first scenario is very easy to understand. The second scenario, there are various bladder forms of dysfunction that could not only promote incontinence but increase UTI risk.
In those situations, do you think pelvic floor therapy is a helpful option?
I think patients who have clear pelvic floor issues, yes, should try pelvic floor therapy. But there are some diagnoses that are, of course, not related to the pelvic floor. So, for example, um, an enlarged prostate in a man
Hmm.
can increase UTI risk, but of course, pelvic floor therapy is not going to help with that.
Right. Do you regularly refer patients to a pelvic floor therapist, or is that not something you do?
I do actually fairly often. For sure, for my patients who have IC or related conditions, I think a trial of pelvic floor therapy is indicated. It's essentially a zero risk therapeutic maneuver.
Hmm.
The American Urological Association guidelines actually strongly recommends consideration of pelvic floor therapy.
Hmm.
Um, and even in my patients who have chronic or persistent UTIs, I do think that pelvic floor physical therapy sometimes helps them recover their bladders um, as well.